Hello and welcome to my channel. Now I want to discuss about characteristics of chest pain that an individual may feel during activity or sometimes at rest. An individual may feel uh, characteristic chest pain. So the origin of chest pain could be from the cardiovascular system or from the respiratory system. Even sometimes the chest pain may arise from the gastrointestinal system. So, from these origins of chest pain, today I want to discuss about the chest pain that originates from the cardiovascular system, especially the heart. When the origin of the chest pain is from the heart, there is a typical characteristics that the individual feel during the chest pain. So, the chest pain that originates from the heart, especially an individual who had who faced acute myocardial infraction or heart attack, there is a typical characteristics of chest pain. This one of the characteristics is its location. The individual feels the chest pain just behind the sternum, or we call it retrosternal chest pain. Just you feel the chest pain behind this is the sternal bone, this is you call the sternal bone, and an individual feels the pain, or no, it's not typically pain actually, it is a discomfort. It's a discomfort that an individual feels, which is characterized by pressure sensation, or we call it squeezing type. Squeezing type, a pressure sensation of chest pain that occurs just behind the retrosternum, just behind the sternal bone. They feel squeezing type or pressure sensation of chest discomfort. And the individual typically shows you just like this. They show a clenched fist just on the sternum. The chest pain could be at the right side or just at the center of the sternum, or sometimes even they may feel the right side of the chest. And the pain typically radiates to the sides, to the arms, and to the shoulder. So it could be the radiation of the chest pain could be to the right side as well as to the left side, and typically the individual tells you the radiation of the pain to the right side or to the left side of the arm or the shoulder. So the chest pain is typically of these characteristics originates from this cardiac origin. So if an individual feels such kinds of chest pain, he or she has to visit nearby health facility, because myocardial infarction or acute heart attack, myocardial infarction or heart attack is a medical emergency. It needs immediate medical intervention that may be medical or sometimes surgical device therapy may be needed immediately. So if an individual feels such kinds of chest pain, you have to take an individual immediately to the nearby health facility. Uh, so this group of individuals, especially who are at risk of having myocardial infarction, acute myocardial infarction, or heart attack. One, diabetic patients, hypertensive patients, and old age, old age, and sometimes this group of individuals they may not feel the typical type of chest pain. In association to the chest pain, sometimes this group of individuals they may feel also nausea and even vomiting. They may vomit, they may have feelings of nausea. So if such feelings are seen, you have to take these individuals to nearby health facility. and they have to immediately evaluate it with electrocardiogram or ECG, what we call ECG or electrocardiogram, and their cardiac troponin should be checked immediately so that important immediate medical measure can be taken to save lives. This is how you approach a patient with uh, characteristic types of chest pain that may resemble the cardiac origin or the pain that may originate from the acute myocardial infarction or heart attack. So this is important today's message. Please be curious for any individual who is feeling chest pain. Even sometimes they may lose their consciousness just being with you, playing or eating food, or even just sitting on a chair. They may fall down. They may fall down due to sudden onset of acute myocardial infarction, and at that time, you may see excessive diaphoresis, excessive sweating. You may see at that time. So please be curious in such group of individuals feeling these symptoms. Please take them immediately to nearby health facility. Thank you for your attention and for your watching of my videos. Please share, please subscribe my channel. Let you help me and I can present more videos. I can present more medical videos for your information. Thank you very much. Please share and subscribe.